Today's topic of discussion is physiological basis of effect of posture on BP. Starting from standing position. In standing position, what happens is that there is increased. So the finding will be increased diastolic BP. The finding is increased diastolic BP, and this is due to the reason or the physiological basis behind this is that while standing up, there is increased pooling of blood in the lower limb, which in turn decreases the venous return, thus decreasing the cardiac output. And as the cardiac output is decreased, it will decrease the systolic BP, because cardiac output depends upon systolic BP. So the systolic BP will decrease here, and what happens? The baroreceptors are less stimulated here. Baroreceptors are less stimulated. So this will lead to increased sympathetic activation through the baroreceptor reflex, and thus increasing the diastolic BP. Finally, there is increase in the diastolic BP. As we know that this sympathetic stimulation can increase both systolic BP and diastolic BP, as systolic BP is already decreased here initially. It is already decreased here. So now the systolic BP due to the sympathetic stimulation will increase and become normal, and diastolic BP, which was already normal, will increase. Thus, in standing position, the finding will be increased diastolic BP. Next is supine position. In supine position, what happens is that the finding is increased systolic BP. So in standing position, it is increased diastolic BP, and in supine position, it is increased systolic BP. And the physiological basis or reason behind it is that with the increase that in supine position, there is increased venous return, which increases the cardiac output, which increases the systolic BP. That's it. So this is the physiological basis of effect of posture on BP.